Good.
Edie Marie, Kansas City, Missouri.
Okay. And so tell me a little bit about how heart disease has touched your life.
Well, do you want me to look at you, or?
Yeah, you can just chat with me for a few
Okay.
minutes.
I wasn't sure what your arrangement was there. Heart disease has had many effects in my life, both personally and professionally.
Okay, so tell me a little bit about your personal experience with heart disease.
Well, my personal experience came on May the 12th of 2012 when I had my own heart attack, and I had to reevaluate where I was at and figure out where I was going to go, because now all of a sudden I had to adopt a new norm.
Mm-hmm. Absolutely. And how did your heart attack affect those you love?
Well, I think it has a deep effect. I don't think that we even begin to scratch the surface on knowing what kind of impact we have on people and our life-changing events. I think initially people are just not sure, because when you have a heart attack or you're diagnosed with heart disease, whatever your diagnosis is, it's not necessarily apparent. People don't see a heart muscle sitting on the outside of your starch, shirt, mm-hmm. and they don't see scar tissue, and they don't see muscle damage, and they don't see an artery that's dissected. So therefore, if you act the same, or if you fall back into your normal routine, then there's not much change, or there's not much effect that happens. But when you establish a new norm after having gone through such life-changing events, it makes a difference where everyone's concerned, from all the responsibilities in the house being shifted all of a sudden to people not understanding, the kids. Little kids don't understand that even though you look the same and you sound the same and you're still Aunt Edie Marie, but something's changed. Whether you can pick them up right away, or whether you can stay up until midnight and watch a movie, or why is she taking a nap? We don't take naps.
Right, absolutely. So do you mind giving me kind of a play-by-play of what happened in May?
Sure. I had just returned back to work. It was a Tuesday afternoon. My mother had passed away the week before, and so it was kind of a light day. I worked virtual office that day, which basically means I work remote. I work for a telecommunications company, and so it was not uncommon to work from home. It was about 4:10 in the afternoon, and I had just finished an expense report and went to get up from my desk, and I said, wow, that's kind of strange, this feeling that I feel. And it was underneath my left breast. And so I went into the bathroom and I got a Maalox, like a chewable anti-acid pill. I had never had acid reflux, or whatever they call, acid. I guess it's acid reflux, right? But I figured I had seen enough people in my household after Sunday's pasta dinner pop them, that must be the thing to do, right? So I took it with no relief. And so I thought, well, this is kind of strange, because this is not letting up. So it's about 4:15 at that time. And I had worked out earlier in the day and came home, so I had kind of a form-fitting Lycra shirt on. And so I changed that, thinking that it might be the shirt, and then got no relief. And shortly after that, I said, okay, it must be this bra, right? The wire underneath this bra. Maybe I washed it wrong. I should have just put it, maybe I should have washed it by hand, like they tell you to do, right? And so, no relief. So I lived next door to a nurse practitioner, so I hollered outside, and she was nowhere to be found. And so then I went back in the house. It was about 106 degrees that day. And I said, wow, this is really strange. So I went to my freezer and got an ice pack. I laid on the floor. Well, as women, we tend to self-diagnose and fix whatever's perceived as being broke. And so as a result, I laid on the floor and did knee to chest, thinking that maybe I had ergonomically set up my desk incorrectly. And so after you do this for about 6 or 7 hours, maybe I done something to my back. So I put the ice chest underneath my left breast, and I still had no relief. Well, by that time, I saw my neighbor in the front yard, so I hollered her, flagged her in, and she came over and she said, I gave her my symptoms, and she said, well, why don't I give you a baby aspirin? So I didn't have a baby aspirin. So she went home and retrieved a baby aspirin. She gave me the baby aspirin, and as she was giving me the baby aspirin, all of a sudden, I feel this pain in my jaw. Well, it wasn't really a pain, it was a discomfort. And I knew about this pain in the jaw for women because at the age of 42, my brother died of a heart attack, and he was 2 years younger than me, and he had been gone for about 6 years. And so I had 6 years to try to figure out if this thing could happen to me too. So I did all the necessary, doctor's visits and whatever, and I was cleared and good to go, right? And so my husband came in from work. I'd already called him during all this fixing. I figured I needed a ride, right? And so he gave me a ride to the hospital, and I got to the emergency room. They got me checked in, and within an hour I was being prepped for the cath lab, because not only did I have a heart attack, I was still having a heart attack, and I needed to go to the cath lab to see what was really going on. Dr. Jason Lindsay was there, and he took me to the cath lab, and upon beginning the procedure, found out I had what was called spontaneous coronary artery dissection. And that's where the artery, for unknown reasons, just dissects. It doesn't have anything to do with plaque buildup. I wasn't high blood pressure, high cholesterol, some of the classic risk factors, right? It was just that the artery had dissected itself. And so when you have a dissection and you have an experienced cardiologist that actually knows that, you just leave the hospital on medication. And that was pretty darn scary. I remember the cardiologist whiteboarding it for my husband to let him know that I just wasn't getting a little anxious. That's what he thought. I was there because I got a little anxious from being back to work, and that I actually had a heart attack, and that they were going to just watch me over the next several days, if not a week, and then send me home on medication to repair over a period of time. I left the hospital, and I was still in denial when I left the hospital. Actually, the day I left the hospital, when they came in to give me the 12 medications that I would be going home on, is when I realized that they weren't talking to me. I wasn't on the opposite side of the bed. I was actually the patient, and that this happened to me. So went through cardiac rehab, several months off work, went back to work, and here I am 3.5 years later.
Wow, and that's an amazing story. And so you also mentioned that you had a professional association with heart disease?
Well, professionally, I volunteer for St. Luke's. I'm in what's called the Pathway to Purpose program, and so I round at the hospital once a month talking to other heart patients that have either been recently diagnosed with heart disease or are living with heart disease, or are on the cardiac floor. And we talk to women about risk factors and, symptoms and just how they're feeling from an emotional perspective. I also sat on the advisory council of the Women's Heart Center at St. Luke's Hospital, because I truly believe that what happened to me, was a warning sign that you can be caregivers to many people, but it starts with you. And that was my wake-up call the day that my event happened. After I got through with the whole denial that this is happening to me, okay, now it's happened to me, and I got through the part that why me, or feeling sorry or maybe even low, then I decided, okay, so what am I going to do about it? And so it's just been full court press ever since then, of course, keeping enough balance that I don't get in the same situation that I got myself into before, with not knowing how to say no, not maybe knowing that stress is always going to be there, but not knowing how to manage that stress. And I'm not a master yet, but I'm knocking on the door to be able to manage stress when it comes my way. And the people that I'm saying no to, they seem to be okay with it. So I'm thinking all along, maybe it was my own internal stressors that, might have caused some unnecessary stress.
I think you're very right. So tell me about, you said that, you're getting really good at stress management. What were some of the other changes you made after that incident?
Well, I've decided to calendar my time with me. So before I just said that I knew that I needed to exercise, but whether I carved out that time to do it wasn't necessarily high on the priority list. Now it's a necessity. I'm looking at it now as a lifestyle change, whether it's exercise, whether it's 10 minutes of meditation 5 days a week, whatever the case may be. I know that in order for me to preserve the life that I have and the heart that I have, I need to put some time in. And before I knew that, but I wasn't doing the work. Now I own it. So
that's great. That's awesome. So how do you, you talked to me a lot about kind of what you're doing at St. Luke's. Are there any other ways that you're sharing this truth with women that heart disease is their number one killer?
Sure. If there's not an opportunity, I create an opportunity, whether it's through the drive-through, picking up my dry cleaner, whether it's at the pharmacy, picking up my meds, whether it's anywhere and everywhere. I look at it as an opportunity not to tell my story because I'm saying, oh, look at me, I'm a SCAD survivor, because the so what of that is so what. I look at every opportunity, whether it's, I'm a Women Heart champion. Women Heart is the national coalition for women that advocate against women that have heart disease. And so with that empowerment, we go out and actually inform, educate, empower women through venues in the community, whether it's hospital events, whether we did oh gosh, she'd kill me if she found out I didn't remember the name. Queen of Hearts Walk, the second annual Queen of Hearts Walk this year. And, we had Women Heart to set up there to advocate, educate, because, the frustrating part about heart disease is we can't get the message out quick enough. It's like a freight train that just runs at a speed that is beyond all of us. And every once in a while you catch a ride or catch a glimpse of it, but it's not compelling enough. And I get frustrated sometimes because telling one woman my story, one person at a time, just seems like a real axe to grind, but a necessity. I can't wait till I see the date or time come where we can get into an arena, into a stadium, into, a population amount of people that maybe don't know about heart disease and the risk factors and the symptoms. And 1 out of every 10 can walk out of there changing one thing about their lives that could be have a positive impact. And that's what I look to do. I really think that we have to figure out a way to come in everyone's household like Apple has. Mm-hmm. Because today smart devices allow us to communicate, but I'm not sure how many people are calling 911 from their cell phones, because the way the statistics look, most women don't call 911, someone else does. And so I'd like to figure out a way, at least if we can move the needle just a little bit, maybe get people to get blood pressure cuffs in their home. Something small that's life-changing and could have a positive impact. We leave our blood pressure cuff out on the mantle at home. It doesn't go with my decor, but it causes people to say, hey, is that a blood pressure cuff? Let me check my blood pressure. And if you can figure out one thing that can make an impact, I think your work has just begun. I'm Edie Marie Battaglia, and I go red for all the women that have come before me, all the women that are here today, and all the women that are yet to come. I want to uncover the truth about heart disease, because until we do, good people will not be here to share all those special moments that have yet to be created. My why is so that for all those times that I haven't even begun to think about could be possible will present themselves. Special moments to come are why.